What do we need to know about the treatment of first episode psychosis? Well, you should know that this is a critical moment. And if you're a psychiatrist or other provider, then you are really going to need to know how to do this appropriately and do it well, because it's going to set the course for this person's entire life, presumably, right? We don't think schizophrenia is something that is cured with medication. It's simply treated and managed. So you want to put the person on a trajectory that they're going to want to stay on and keep them engaged in treatment. There's a couple of key rules that I always follow. The first one is going to be never use a high dose of antipsychotic medication for somebody who is having a first episode. Patients with first episodes tend to respond very well to lower doses, and they're extremely sensitive to the side effects of the medication as well as the medication in general. The body is just not used to having this dopamine blockade. So you don't want to go really hard up front and then have a difficult time retaining the person in treatment because they're having such bad side effects, or they're just having a real hard time acclimating to the use of the medication. The second thing you're going to want to keep in mind is you want to start with the second generation medications. Although many randomized controlled trials have told us that first generation drugs such as haloperidol offer the same efficacy in terms of treatment, they don't come with the same side effect profile, and they also have other risk factors that we're going to get into here. So although the efficacy is similar, we want to keep in mind that second generation drugs offer many advantages. Number one, longer duration to first relapse. So patients who are on second generation drugs have a longer duration between that initial episode and the first relapse, which is really important because the more relapses one has, the more damage that occurs, and the less likely it is that treatment is going to help, including things like clozapine. We also find the second generation drugs offer better retention in treatment. We want to keep people in treatment. We don't want them leaving prematurely. There's also a higher probability of staying on medication when you use a second generation drug. There's also reduced risk of what we call anticholinergic medication use. So things like benztropine to mitigate some of the side effects, like for example, Parkinsonism associated with first generation drugs. You don't have to give an anticholinergic, which is known to cause issues with cognition, as well as causing systemic anticholinergic effects. There's also a lower risk of tardive dyskinesia with second generation drugs. Although this is somewhat debated, there is enough evidence to support this concept that second generation drugs have a reduced risk of tardive dyskinesia. So many good reasons to stay on these medications.